You may have seen recently that Angus developed an abscess. But what is an abscess and how did he get one? So, an abscess is basically a very localized infection, generally taking the form of a pus filled pocket, which is a collection of bacteria. Any animal can get them, and they don't only form in hooves on horses, but hoof abscesses are among the most common and the most painful for horses. This is because the hoof is a tough enclosed capsule. So when an infection takes hold and a pocket of pus forms, it exerts outward pressure, but that pressure doesn't really have anywhere to go. So it compresses the tissues and nerves around it, causing a good deal of pain. This is why one of the first clinical signs is often sudden onset severe lameness in one leg, especially when there's no sign of external injury like a cut or localized swelling. It's especially scary when a horse is suddenly unable to stand on one leg. It raises all sorts of frightening possibilities. But thankfully, they're easy to treat, if sometimes hard to diagnose. Horses can hurt their legs in about a million ways, though, so it's important for a vet to rule out other potential causes of lameness, like a fracture. So, x rays are often called for. Even if the x ray doesn't catch a fracture, it can help diagnose an abscess, since a characteristic gas pocket in the hoof will often show up on an x ray. Vets check for abscesses in other ways as well, including blocking nerves in the coronary and pastern to try to isolate whether pain is above or below the point of the leg, and using hoof testers to pinch on different parts of the hoof and sole to see if there's a particularly painful area where an abscess might be hiding. Because generally, you won't be able to see it until it ruptures, which is actually a good thing. Because the abscess will keep growing and exerting more pressure, it will essentially travel through the hoof, seeking the point of least resistance to rupture. This can give the horse a great deal of relief, though it doesn't heal the infection. If possible, however, you want to control the direction of travel and rupture. The two weakest areas of the hoof where an abscess will seek release are downwards through the sole and upwards through the soft tissue of the coronary band. The coronary band, however, is an especially critical zone at the bottom of the leg, just above the hoof, with crucial blood vessels, ligaments, and nerves. So, an abscess traveling and rupturing through the coronary stands to do a lot more damage than one that can be drawn downward to blow out through the sole. This is why in Angus's videos, you'll see that we are applying a medicated pad to the bottom of his hoof to draw the infection through the sole. Sometimes Epsom salt soaks are called for as well to help the drying out and disinfection process. So, what causes an abscess? The two main causes in horses are injury and wet conditions. Basically, any time an opening is created in the hoof for bacteria to gain entry. So, stepping on rocks or nails, creating a hole or crack, or when persistent wet conditions cause some breakdown in hoof tissues, which you may see especially in the lamina, which is the white line between the hoof wall and the sole, and the frog, which is the cushiony part at the center. The best treatment is prevention, since abscesses are painful, can cause lasting damage in some cases, and it can take months for a horse to fully heal. One important step you can take is to keep your horse's stall as dry and clean as possible and to treat any cracks or holes you see developing with a hoof mud or other treatment to block off bacterial access to the interior of the hoof. We're lucky at Mountain Shadows that we live in pretty dry conditions, so Angus's is actually only the second abscess we've seen at the rescue in our 5 years and over 50 horses, but injuries can still happen, and hoof conditions do vary. If you like seeing this and other content, don't forget to like, comment, and subscribe. Thanks.